Hey everyone, I will be speaking with Dr. Smikle from Laurel Fertility Care today about fertility in the workplace, which I feel is such a massive topic, which not many people talk about and everyone struggles with. And so we're going to talk about what you can do to discuss it with employees, with your boss, for example, employees, whether you need to talk about it. They've just written a fantastic article for us. The link is in the bio, so go and check it out because it gives tips and advice on how to cope with fertility whilst you're at work. I really struggled with it, and I'll talk a bit about that, my personal situation, whilst we're talking. But love to hear your thoughts on it too and how it's affected you. Does anyone who's watching, have you felt affected with work and going through fertility and IVF? It's really hard. So let's see if they're here and we can start. If not, we'll just wait a minute. Yeah, so I just felt really concerned that by being open with my bosses about us needing IVF, us needing sperm donation, us looking at going abroad for treatment, I just felt that it would totally derail all the work that I put in to work my way up in the company and be promoted. And that they'd know that I was obviously trying to have a baby, and then they'd think about maternity leave and what that would mean for the company, and it was just so hard. And I had to take time off as holiday, and obviously it wasn't a holiday. So I'd love to hear about other people's experiences. How have you found it? And have you told your employees? I think one of the things that I did... Oh, here we go. It's been hard. I feel like I had to tell them, but it worries me about the promotion. Yeah, I felt exactly the same. And I do think it did affect that, if I'm being honest. And also, whilst you're going through treatment, you feel like, and tell me if you don't feel this way, but I felt like I had to update them on everything I was doing. So the time I'd need, obviously, how it was going, when I'd be back in, whether it had worked, telling them as soon as I took the test, they were asking whether it had worked. And that was highly stressful because obviously if you're trying to conceive naturally, you don't need to tell your boss straight away whether you're pregnant or not. And when it didn't work, the reaction was kind of like, oh, well, bad luck. Someone just said, I'm really struggling with the thought of returning to the office after working from home. Yes, I feel like my brain is full capacity and I've got privacy at home. I can totally understand that. I would feel the same. And also, when you're working from home, you can manage your diary a bit better, can't you, in terms of not physically needing to be there, so people don't necessarily need to know your whereabouts every 5 minutes. And someone said, yes, staff having babies, not me. IVF starts in January. Good luck. My boss has been great. She's been supportive. That's fantastic. I'm so glad to hear that. Right, let's see if... Here we go. Dr. Smikle's here. I'm just going to... And I love the fact that we're speaking with a fertility clinic about this, Laurel Fertility Care, because I think it's so good to hear medical opinion on this and perspective on it as the caregivers. Someone just said they had to tell their employers before embarking on IUI process. And then they ask questions, don't they? Like, how long is it going to take? What are the next steps? When will you try again? And it's just so much to deal with on top of everything. Someone said, I've been open with my managers. They've been really supportive. I even got promoted. I worked hard. I'm glad it wasn't impacted. That is amazing. I love that. We need more people like that. More experiences like that. Right, let's send a request. He should be joining any minute. Hello, hi to those who are joining. Dr. Smikle from Laurel Fertility Care is about to join, the medical director. My manager has been super supportive. That is so good. Love that. Is there anyone who's had a negative experience? It's saying that he can't join. I'm just going to see. We'll try again. We'll wait until he's here. If not, I can hop off and hop back on. I'm so glad to hear that people have been supportive. I think the other thing that we're going to discuss tonight, and I'd love to hear other people's experiences. I was very much in the office whilst I was having fertility treatment. It was before COVID, and I had ex-colleagues come in who just had babies, and everyone would just huddle around them, just, you know, screaming with delight and asking to hold the baby and sitting next to that person. I mean, you're so happy for them, but I had to walk out and go off for lunch because I found it so hard. Someone even said my manager attended my appointment with me when my hubby couldn't. That is amazing. I absolutely love that. Amazing. Okay, let's see if he's here now. Try again. Thank you for your patience. It's going to be a very worthwhile chat. It's not connecting for some reason. Oh, there we go. Hi, Dr. Smikle.
Hi, how are you doing? For a
I'm
lot
well,
of
thank
technical
you.
delays there, I'm sorry about that.
That's fine. We're
So
live now, so that's great. How are you?
that's okay. I'm doing okay. Can't complain too much. Definitely
Good.
can't complain.
So
So,
I've actually already been speaking with the lovely people here on the live right now about their experiences of fertility treatment and infertility at work. Some people have said they really feel as though it's affected their promotion and their career progression. And other people have said that they've got really supportive bosses and companies who have, one lady even said that her boss attended a fertility appointment with her when her husband couldn't be there, which is amazing. And I just said, you know, as the medical director of Laurel Fertility Care, it's so nice to be having these conversations, speaking to you guys on the sort of patient receiving end to hear about your tips for people who are going through fertility and balancing that with work, and also what you see with your patients in terms of the struggle that can come with managing both. So I'd love to hear your thoughts on it.
well, thanks, and I apologize again for the delay in getting into the room. But I think the important thing in terms of considering how to manage and how to think through much of this is to think that this journey is a difficult one, regardless of how you start the course, and it is always going to be stressful. Dealing with work, many patients don't want to tell their coworkers or their boss about going through the process, and I think that brings its own challenges. Many of the times that when we talk to patients about that, what we try to advise them to do is, if they're not going to be able to share that information with some of their other colleagues, at least have some resources where they're going to end up having to talk through and to have some of the stress relief, because it's going to be a challenge no matter what. It's true that some work environments may not support the process, but you'd be surprised how many would be, and having that conversation is going to be important. It's just a matter of how to think through and how to imagine, having the conversation so you can feel supported through the process. And I think that's actually the first thing to consider.
Mm-hmm.
And we try to help patients with that conversation as well.
That's amazing. I remember I had just moved teams when we were starting IVF, and it was like a blessing that I was in a new department doing something new. So it was like something fresh to take my mind off fertility treatment and arranging to go to America and everything that came with it. But at the same time, it was terrifying knowing that I needed to impress them. I
Mm-hmm.
wanted to be promoted. I was due to be promoted. And I had to have that conversation really early on in transferring into that team because of the timelines of us starting treatment. And even putting that meeting in the diary was terrifying, not knowing what to call it, not knowing how to open the conversation up. And my boss was sweet, but she definitely didn't understand. And so what I did was I went away and I spoke with a medical team, and I got some timings together. And because I'm quite a sort of organized person, I put together an Excel spreadsheet, which was color coded, showing my timeline, my husband's timeline, what we were doing, when we were doing it, so she could just see the enormity of what comes with treatment. And I printed it out in A3, and it was so big, I had to sellotape the sheets together to go along like this. And I put it in front of her so I could talk through the timings. And she said, "I'm so glad you did that, because I didn't realize how much was involved in IVF in terms of even from a time point of view."
So that's actually a really good way to kind of put that into context. And I think you're right. Some, managers or some bosses may end up needing to see that information, so therefore they can have a better sense in terms of what, to expect. Many times, especially when, people have not dealt with this directly, then you'll see that, they may not understand what it takes and what it means to go through the process. And so, yes, you're often left with making the decision, well, should you actually share this with an individual? And when you do, trying to not to have any repercussions from that conversation. I do think that what you did was a brave one, and I think, at least in my experience now, in terms of talking to patients who are in a lot of different teams, a lot of different companies, they're finding a lot more support for that. Part of it may be because it's a requirement that managers and bosses support any kind of medical process. A lot more have actually gone through a similar process, so therefore there's that part of the understanding as well. But it's always going to be a challenge in trying to bring the conversation up, even in, believe it or not, in medical communities, even though we're supposed to understand this. It's just that everyone starts looking at some selfish measure to say, well, how is this going to affect me, and where am I going to go, and how am I going to actually manage these things? And it's important to realize that all those things are actually ones where you can work through them with enough information, with enough preparation, and with the right team. But it's getting the support you need, if not in the work environment, then at least having others kind of basically provide that information so you can bring it back to that environment to say, this is what you need to do, this is what you have to do to support me.
So you mentioned that you have patients who come in and you help them, you assist them with that process,
Mm-hmm.
which is incredible, by the way, which goes with your holistic care. What kind of thing would you do? Would it be that you would sit down and work out the timings with them so that they've got the right information to then give to their employer?
Well, I think the key thing we try to do first is to look at specific measures, specific ways to kind of make sure that when we're looking at trying to limit their interference on in their work environment, because that's one of the things patients get concerned about. Creating a schedule, creating a timeline that's going to minimize the impact on their work. Trying to schedule it so therefore there's having as little time off as possible, at least initially, because we understand that that's one of the key things that their boss may be concerned about. And then planning it so therefore if they need to, they can actually take whether it be medical leave or request days off, so therefore they can cover those things. But the more forecast you can provide, the more supportive a work environment is going to be, because they'll know how to plan around that.
Definitely. And also, I guess there's uncertainty, isn't there? Because everyone knows that it can be unpredictable, fertility treatment. You know, it's how long's a piece of string. So what happens midway through a cycle, for example, for people who have said, I need X amount of time off, but actually things are changing? Like, how would you advise they manage that with their employer?
Well, I think the key thing is basically first to have an open conversation with an ongoing conversation to realize that this is a medical endeavor, this is a medical procedure, so therefore, although you try to provide measures to say, well, these are the timelines when I think this should happen, there may be unexpected measures where it's not going to be absolute to say this is the day when this is going to happen. So under those circumstances, it's going to be important to realize to say, well, okay, I'm going to end up actually having to, take this other day off. Or you can do all the things to say, I'm going to be I'm going to be taking Friday off, but the retrieval ends up being on Monday or Tuesday, and so you have to adjust time period. So providing information and then providing the documentation to support that, so therefore they can actually make sure that those visits are going to be medically covered as a necessity. That's going to be the important way to support them as well.
Definitely. For those who have joined, Laurel Fertility Care have written a fantastic article giving you brilliant advice, 360 advice around how to manage work and fertility treatment. So go to our link in bio to read that. One of the things that you mention in that article is, I think, a study that Carrot Fertility found. And correct me if I'm wrong, but it was around 23 or 25% of people that they had surveyed feel uncomfortable or don't feel that they can talk to their employer about it. And that's a huge amount of people around the world, isn't it, to feel that they have to keep it secret, such a big thing secret.
Well, I think there's two parts to that part. So you're right, a high percent of the patients are not going to tell their boss about it. Part of it is just that, many of these, patients are feeling very, there is a lot of blame, and there's a lot of belief that it's their fault, and they don't want to actually feel that they're going to end up being further blamed at work. So therefore, that may be one of the reasons why they're not going to tell their boss. or their managers. But a big part of it is just that there's just so much fear and misunderstanding about what the process involves. And even if they know what the process involves, it's going to actually be much about how to make it so therefore they're going to get the support they need. And it's always challenging. It's always challenging to feel that you're going to hear the word no, because the word no is going to be the one that especially when it comes to the patients going through the fertility treatment, their body may be telling them no in many ways, and hearing an external no from someone else saying you can't take this time off may be devastating. So therefore, that's another part of the measure you have to consider as well.
So for us personally, we went out the first time for the whole, my husband, microtessie, my retrieval in the States. It was a big trip, 3 weeks, took some medical leave, did not work, had 2 embryos left, had to go back, wanted to go back to try again with those last embryos. I wanted to go back then basically the next day, obviously had to wait for the cycle and things to return to normal. I spoke to my boss at the time and said, listen, obviously devastated it hasn't worked. We need to go back to America to try again. And I had to take that as holiday the next time. And I wasn't able to go at the time we wanted because someone else in the team was on holiday, which I totally understand. But it was so hard to hear that, to delay it because I was waiting for another month or two because of that. And then I started to think, that's really strange that sort of these timings predict not whether it's going to be successful, but if it is successful, that will change when the baby's due and all these sort of other things come into it. And so I did have to wait a little bit, but it ended up not being a problem. But it's a lot to juggle, isn't it?
It is a lot to juggle, and it's many times couples who conceive naturally or with little effort will take things for granted. And they don't realize the effort it takes in terms of planning, not just work, but school, all those other things that you're thinking about. And so therefore, it does become one of those things that each time you hear no, even if it means that it's because someone else is going on leave and you can't take leave at the same time, it's devastating. It's devastating. So therefore, having a team, having conversations around you, having a support group that's going to be able to say, look, it's not the end of the world. You still have a great opportunity, and then having people to kind of nurture through that, it's going to be important. Having that in the work environment is phenomenal because at the same time, you can have a supportive boss that will say, well, look, I've gone through this experience before. I realize I can't tell you to take this time off because, someone else is doing it. But, having that measure to say, well, we're going to make it sure that you're going to have the time you need and be supported, that's going to be what patients would love to hear. And many times they do. It's just making sure you ask for it.
Definitely. At Laurel Fertility Care, what times do you monitor in the morning?
Well, we primarily monitor as early as possible in the morning, so therefore patients will actually have as little time off as possible. We try to support that by basically having multiple different locations, so therefore patients will actually have access to fertility services close by to them and not have to take extensive time off. We do have our main location in San Francisco, so therefore patients who are actually having services where you're having either retrieval or transfer will have to plan that time. Most times you're going to be taking that day off anyway, so therefore that's a planned event. We try to support that. But you're right, many times, just taking off just 1 hour or so in the morning or doing it before you have to go to work, those are things we try to do, so therefore patients will actually know they're going to be supported through the endeavor.
I remember Karen Jeffries from Hilarity Infertile, she was telling me that she used to have to wake up at 4:30 in the morning to drive over an hour to her clinic, then wait for monitoring, to then be at school because she's a teacher in time for lessons to start because she was not able to be late as a teacher. And that is very early to start your day, isn't it? On top of wanting to sleep and all the other emotions that come with it.
And adding to that, you have to remember that most times when you're going through that infertility journey, you're taking these medicines primarily at night. So therefore, that's also going to limit your time to sleep. So in her situation, having to come and get up that early, it's not uncommon, and especially in large clinics where you end up having a lot of monitoring done really, really early. and procedures scheduled. So therefore, that's actually something to kind of consider. What we try to do is to make it so therefore we have satellite locations. So rather than having her come all the way into San Francisco, she can be seen in one of those satellites if that were the situation, and then minimize the amount of time she takes. Because you're right, it's devastating. Alternatively, what we've done in a situation like that is have her come after work if we can, and therefore if it's not going to actually impact the monitoring. That may be some beneficial for some patients, or they can come during their lunch hour if it's actually close by. So we try to do whatever we can to minimize disruption for patients. So that's going to be important. It's not going to work for everyone, but that's what we try to do.
Well, the flexibility is incredibly important and helpful for patients. How does that work? Because am I right in thinking that clinics generally tend to monitor first thing in the morning because you need to send off the bloods to get them back in the day to be able to give people their protocols that afternoon for the evening?
Right. Well, fortunately, in many of our locations, we have the laboratory services on site, so therefore we can have access to the material and have access to the lab results relatively quickly. So even if they're coming in the afternoon, we'll just delay when we actually stop running the blood, so therefore we can get the results back, and then still have the information to provide them to do their treatment that next day. So we're trying to make sure that we have timely information and patients are supported, and that's our main goal.
That's brilliant. And does anyone have any questions for Dr. Smikle that they want to know or understand about managing treatment alongside work? I'm just looking at some of the things people commented before. Let's see. I guess, is there anything people can do to sort of reduce how much monitoring they have, or does it depend on the person and the protocol that they're on?
It depends on the person, it depends on their reserve, it depends on the protocol. In patients going through IVF cycles, that's the one where you end up having the most frequent monitoring. And things that we try to do to navigate that is to schedule their initial visit as close to the weekend as possible. So therefore, part of that next monitoring could be on the weekend. So therefore, that minimizes disruption of patients working Monday through Friday. We realize that some patients work on weekends, so therefore we'll have flexibility in terms of timing that. So it's truly working with the patient, finding out what's going to be the optimal time for them to kind of go through and be seen, and managing things that way. And I think that's going to be the approach. In doing things, I think the important part is first asking patients what's going to be important for them, and working with them to kind of navigate those measures, because it's going to be different for everyone.
Definitely. Yeah, there isn't a one-size-fits-all really for this, is there? I think the other thing that we haven't really spoken about, which I mentioned before you came on, was what happens after the treatment, because we talked about stimulation period and retrieval and time off for that. But one of the big things that I noticed was, because I had told people at work and I'd been so open about it, there was an expectation that I'd update them the moment I got the pregnancy test result, even the day of. And that pressure was quite big, because it just felt unfair that I needed to divulge that information when people who were trying to conceive naturally didn't have to be so open about it and might not tell an employer until 12 weeks.
That's actually a really important part of the conversation that few people are actually able to manage without really having much help. The biggest part of that is just that, yes, and there's a lot of involvement. I'm not sure it's necessarily one you can avoid in terms of when patients, when you share that information with your work team, they're going to be invested in a way very different from someone who's actually conceiving naturally, because they're going to want to know everything that's happening to you, not because they're trying to be either spiteful or meaningful. It's just that they want to share in your success just as you do. They're sharing their success, but many times they don't actually have the same ability to manage the losses, and there's sometimes that can happen. And so, that's something that's devastating in terms of patients going through, sharing this information, and then having to come back to tell them, this didn't work. Because then their colleagues and employees, their boss, may actually say, okay, I'm sorry, but then they move on while you're actually then have left with being able to manage this loss. and they're not going to be able to support you, or they're not going to provide the time to support you as you go through that loss afterwards. Even if you're successful, just because you're successful, you're going to need to end up having some measures as well. So simply saying, yes, you're successful and you're pregnant, yes, they'll be happy for you, but you're not going to actually have the same amount of anonymity as someone who will actually go through and get pregnant naturally. So you're right, all those challenges are going to be there. And there's a lot of pressure in terms of basically having this child, if you will. And that's always going to be a challenge, always going to be difficult.
Mm-hmm. Definitely. I think you're right, though, when it doesn't work as well, you know, people may say, I'm so sorry, I'm sorry to hear that. But then that's sort of the end of the conversation. Then you just go back to work and you just sort of
Right.
feel like you need to forget it.
Right.
And then they're probably thinking, well, when's she going to go back and try again? Because it's not just
Mm-hmm.
here. So it's really hard to be open this whole time, because everyone knows what the end goal is.
Mm-hmm.
And also, if you are successful and you tell them, their first thought is, well, I guess it's this month, so then you'll be leaving for mat leave at this point, resource, all that sort of stuff. And it's hard. And obviously, is also when you have a pregnancy after fertility treatment, you have preliminary scans, etc., don't you?
Right.
So that there are more appointments that you need to attend just to check everything's on track.
That's all true, and the scans, all those things. Yes, it's the things that you still need to get done, and they'll help and they'll support you to manage the way through it. But it's very, very different than someone who basically starts out having a natural conception, only because initially when you have those scans and when you have those doctor's appointments, many times you may not actually tell your colleagues, you may not share that information, so you actually have some separation for a much longer period of time. For some individuals, it's until you start showing where you can kind of maintain that anonymity and maintain that distance that you're going to be able to protect yourself. Whereas someone who goes through the process, and especially if they're sharing it with everyone, their success is just one thing that everybody now knows, and everybody knows that timeline. So therefore, it becomes a much, much more open and a more challenging way to kind of, live your life in that open environment when that's not necessarily something you want to do. Each of those approaches are different, and I think, individual will get support from one or the other. But, the biggest part of basically preparing someone for the workplace is just to make sure that they need to understand where they're coming from and what their needs are, and try to manage things appropriately. Sometimes it's not best to tell everyone that's going on. You may select to tell key people, but not one that's going to share with everyone else. And that's an important thing to realize as well.
I think that's a really good point. And also, we're still in October, Baby Loss Awareness Month.
Mm-hmm. Mm-hmm.
Things don't even if you get a positive test, as you well know,
Mm-hmm.
things don't always go to plan. So what about people who have told work, it ends up being positive and then it ends up being a loss? How do people navigate that journey with work?
And that's a huge thing. So therefore, each of those steps are really, really challenging. So therefore, again, depending on the work environment, depending on the people, it's not a one size fits all where you're going to say, well, this is the support you're going to feel, this is the support you're going to get. Some work environments are going to be really great in terms of things. They'll support you and nurture you through that loss just as well as before. But I'd say that many times what will happen is just that it's not something they can truly understand, or they'll say, well, I had a loss as well. It'll be easy. You can just get pregnant again, not truly understanding what it means for some individuals who are going through the fertility struggles, because it's not quite as easy as that in terms of saying, well, just try next month, just because it involves a lot more. Even if you're actually having services covered by insurance, so therefore you're not having to come out the financial loss, the emotional loss, just the time involved in everything else, the psychological loss is going to be hard. And not everyone actually has the capacity to do that. One of the key things we talk about with patients is making sure that you end up having to maintain that emotional bandwidth to protect yourself, because that's the greatest resources you're going to actually have throughout the journey. And maintaining that resource is going to be a key part in however you need to do that, because that's going to help you in terms of your success.
Mm-hmm. Yeah, 100%. Someone raised a good point earlier on here. They said that they're really nervous about being in the office after working from home so much during COVID, because you can hide behind a screen at home and you can wear comfortable clothes and you can eat what you like and you can just be a bit more relaxed at home, can't you?
Hmm.
Suddenly you're thrown into an office environment and everyone's sort of watching your every move. So it's a different thing to navigate again with COVID on top of it, isn't it?
It's a mixed blessing. So there are a lot of individuals who sought fertility treatment during COVID because it provided them that anonymity. They actually were able to work and then, mix in their treatment without having to share with everyone what they were going through. Some people decided what they were going to do is extend their work hours, so therefore they're working, after everyone else is gone home, but no one's checking on them, so therefore it allows them a lot more flexibility. That benefit goes away when you start going back in the office and having to do that. And that may be part of the challenge you're seeing now when patients are saying, well, I feel more comfortable working from home. One of the things that I know is just that there are a lot of resources to kind of confirm that some people are more productive working from home. So it's a process where employers are going to have to see just what that means in terms of going through each time and what that's going to entail. So that's an important part of everything.
Definitely. I'm just going back to my personal experience of work and fertility treatment. When our daughter was 10 months old, we went back to the States to try and do another round of IVF to prepare embryos, because I wanted to do it whilst I was still on mat leave before going back to work, because I was so
Mm-hmm.
nervous about telling them about it again and having to get the time off. And we were very fortunate that it worked that time with twins. Um,
Mm.
However, the age gap is slim, and we did it in such a rush because of work and because of
Mm-hmm.
our fears around having to take more time. And that was quite a stressful time to be sort of packing it all in to fit into returning to work, especially after maternity leave. Um,
Well, the important part you talked about that, you kind of glossed over was just that then you had twins. And, that probably was not something that you had actually wanted to or planned in terms of your family. That was just something that you actually then had to deal with. And so therefore, expanding from a family size of 1 to 3 is no small feat, something to kind of consider. So it must have been really, really challenging, not just emotionally, but in other ways as well, to kind of basically have to deal with all that because of the expectation of what you wanted to deal with at work. So that's a big challenge, and people must commend you for that.
I think also when people return to work after maternity leave, you can often end up being in a different department or a different role or
Hmm.
whatever it might be. I had a new team to report into. And when I told them that I was pregnant, I did wait until 12 weeks at this point, because I wore baggy jumpers and I'd had the treatment before I went back. But I was so apprehensive about the conversation. I was rehearsing it in my head again and again. And I felt I needed to give the backstory of our situation and what we'd been through to get to this point, to justify the fact that I was, going to be going on maternity leave again.
Now, and that's true in terms of feeling like you have to share a whole lot of information and a whole lot more just because of what you experienced before, and so you, like many people, are then you're going to be oversharing, if you will, because you want to make sure that you have a staff that's supportive and that they're going to provide you support when you go back through. And you don't want them to blame you for going back out on maternity leave after just coming back from one. So again, having resources, having support, having people is going to be a really, really key thing to kind of consider going through the process, because that's the only thing that's going to help you in terms of managing that long period, the long expectation,
Mm-hmm.
what to do. So yeah.
Mm-hmm. There have been some really positive comments tonight. Oh, sorry, today, from
Mm-hmm.
people. Someone's just said that when they experienced a miscarriage, work told them to take as much time as they needed. Again, very supportive. This lady took 3 weeks, which she really needed to process the grief. And I think
Mm-hmm.
that's incredible, isn't it? Because it is a huge emotional toll. And as you said, to just sort of have someone gloss over it or not respond to it or not give you the time can only make things worse.
That's actually a really phenomenal thing that the person had as an experience, because that's a loss that's there. I can only wish and I can only hope that that same an employer might actually say when your cycle didn't succeed, take time off to grieve as well, because that loss is not any less. It's not any more less devastating than a miscarriage. So, I think we need to basically provide support and to provide measures to kind of support any type of loss, however they exist, whether it be loss of not being able to get pregnant with a negative cycle, or a loss when you do get pregnant and miscarry. But, just as much as the loss when you actually go through and then you have to basically spend time with that child for however long you need to. Any of those things are ones that you're going to have to kind of have support for.
Absolutely. Thank you so much for all your advice and tips today. Anyone who's joined, please do head to our link in bio to read more from Laurel Fertility Care with their advice and how they support people too. Also, if you'd like to schedule a consult with the team, you can reach them directly or DM us and we can help put you in touch. They're a fantastic clinic based in San Francisco with multiple locations. And so, yeah, thank you so much, Dr. Smikle, for your time today. It's always a pleasure speaking with you.
And thank you so much, and I apologize for all the technical difficulties that come around from doing this. That's fine.
Thank you, everyone, for joining. Have a good rest of your day.
Take care now.
Bye-bye.
Bye-bye.
Bye.